Hi, my name is Samantha Neckles. I am a graduate student in the Faculty of Health Discipline at Athabasca University. The title of my poster is Decolonizing Nursing Education Towards a Culturally Safe and Inclusive Curriculum. This work is personal and timely. I have witnessed how nursing education shapes not only the competence of nurses, but also the safety of the patients we care for. When nurses or healthcare education does not reflect diverse learners or prepare learners to care for people from different cultural backgrounds, inequities in care persist. This is why this project connects directly to the theme of this conference. Research for a changing world. In a world marked by inequality and cultural diversity, research that reimagines education is critical to building systems that are just and inclusive. Canadian nursing education remains dominated by Eurocentric biomedical frameworks, while sidelining Indigenous, Afrocentric, and collectivist worldviews and ways of knowing. The consequences are clear. Internationally educated and racialized staff are often marginalized. Nursing competence is reduced to narrow technical skills, and inequities in patient outcomes continue to deepen. Indigenous and Black communities in particular, they will continue to face systemic racism. And so the purpose of my project was threefold: to critically examine how Eurocentrism shapes learner identity, belonging, and clinical reasoning, to propose a framework for education reform rooted in equity and cultural safety, and to evaluate the feasibility of this reform education through a SWOT analysis. I grounded my project in the colonial theory, Freie pedagogy, and cultural safety perspective. A literature review was conducted. I used 30 scholarly sources, intentionally selecting from Indigenous, Afrocentric, Black, and Eurocentric nursing and health journals. The center, if you look at the center of my poster, it will highlight the findings of the literature review. Eurocentric curriculum focuses on standardization and technical accuracy. Inclusive curriculum, on the other hand, emphasizes diverse ways of knowing, and it redefines nursing competence as relational, ethical, and equity focused rather than technical. From this work, I propose 5 pillars for inclusive nursing education. One, epistemic inclusivity, recognizing diverse knowledge system as fundamental, not token gestures. Two, critical dialogue, replacing passive lectures with reflection and collaborative knowledge creation. Three, relational accountability, viewing education as a reciprocal and collective process. Four, faculty transformation, ongoing training in anti-oppressive, trauma-informed pedagogy for faculty. Inclusive assessment, which evaluates not only the technical skills of our nurses, but also cultural humility, ethics, and communication. These pillars serve as a blueprint, or they can serve as a blueprint for meaningful structural change in nursing education, not merely symbolic gestures. The SWOT analysis on the right of the poster evaluated the feasibility of this education reform through an equity perspective. The strengths include: one, alignment with the Truth and Reconciliation calls to action and evidence that inclusive curriculum enhance patient outcomes. The weaknesses involve faculty readiness gaps. The opportunities are found in the momentum for equity, diversity, and inclusion, as well as building strong community partnerships. The threats consist of tokenism, rigid accreditation standards, and resistance framed as protecting professional norms. The recommendations listed on the posters on my poster is clear. Invest in ongoing faculty development, incorporate community voices as co-designers of education or co-developers of education, redefine nursing competence framework, and ensure that accreditation standards align so that cultural safety becomes a structural expectation rather than an option. Decolonizing nursing education is not just symbolic, it is crucial, it is structural, and it aligns directly with research for a changing world. This project demonstrates that reform is achievable, urging us to prepare nurses who are not technically skilled, but also culturally safe, relational, and committed to equity. All references for this project can be accessed via the QR code on the poster. And I would like to acknowledge Dr. Kristen Petrovic, along with my colleagues and my mentors at Unity Health Toronto, for the support and ongoing guidance on this project. Thank you. Thank you for your time, and I look forward to your questions.